I want to do an illustration of the size difference between a Gantry treatment room and a fixed treatment room equipped with upright treatment equipment. What you can see here is a floor plan of a Gantry drawing that I got off the internet. It shows the Gantry structure has a radius of about 18 feet. And you need to add another 2 feet to allow the structure to rotate around the patient. What you see there in blue is the beam delivery nozzle that is rotated by the Gantry structure around the isocenter. And if we would model a fixed beam room here, we can say let's install a fixed beam nozzle which is just in the straight path of the beam line, and these two nozzles share the same isocenter for illustration purposes. The area that we need inside the Gantry room is shown here by that rectangle, and we can assume for the sake of the argument that we need the same space for an upright treatment room. The blue area is now that rectangle shaded, and we're going to expand that in 3 dimensions by pulling the blue area up another 6 feet above isocenter, and we're going to also pull it down by another 4 feet below isocenter, which will give us a total ceiling height of about 10 feet, which is adequate for the upright treatment room. So what we have there now is the volume that we need to treat a patient either in a Gantry or in a upright treatment room. Now we're going to do the same with the Gantry, and we can see the shielded walls in the Gantry floor plan there, and we can mimic the square foot area at the isocenter level by that blue area. Now that, in order to rotate the Gantry, we need to pull that volume up by that 20 feet radius that we need to rotate the Gantry and create the free space, and we also need to pull it down by 20 feet from the isocenter to allow us the Gantry also to rotate in the bottom half. So we see therefore a 3-dimensional volume now, which is the area, the volume that we need to shield to operate a Gantry. We can hide the front face of this box and rotate it a little bit so that we can see the sheer volume of that shielded area, and then we can switch on the box that we need for the fixed beam room and also hide that front surface. And now we can see that incredible size difference of the shielded area. That is the area that we need to shield from radiation if we want to build a fixed beam room versus a Gantry treatment room. The volume difference is north of 15 times, which is quite substantial.